Good morning, everyone. Russ Barkley here. And if you're in the United States, well, today is our Thanksgiving, and I certainly have a lot to be thankful for. My two sons and four grandchildren, of course, as well as my loving life companion, Gabrielle, with who I live, along with her 15 grandchildren and three sons, not to mention a bevy of friends and others with whom I frequently socialize. So I'm grateful to all of these individuals, and especially to you, the viewers of this channel, for making it such a success. So today I want to speak about a very important topic that adults with ADHD may have to consider when they are in the workplace and they are contemplating disclosing their ADHD to their employer. Usually here in the US, this would be done because the individual wants accommodations in the workplace under the Americans with Disabilities Act. That's not a requirement, though. You can ask your employer for such accommodations if you think they are open to providing them, even if the ADA does not apply to your workplace. More on that later. But there are some things that you need to think about before you disclose your ADHD. You don't just go running down the hallways of your workplace shouting out what a gift your ADHD is and that it's your superpower and so on. Those kinds of ideas have no place in the workplace when you wish to get some kind of accommodations. So let's just make sure that, for heaven's sake, we don't go viewing ADHD as some gift you're going to unwrap and it's going to benefit your employer. Highly unlikely that they're going to see it that way, and even more unlikely that you're going to get any accommodations if that happens to be the view you wish to espouse at work. So, should you tell your employer? Well, it's hard to say. There's no straightforward answer to this because it really depends on the employer. In general, I suggest that you don't disclose your diagnosis unless you feel you need and wish to seek accommodations, again, in the US, under the ADA regulations. Otherwise, you might want to think very carefully about it. And the reason for that is that in my experience and that of my other colleagues who specialize in adult ADHD, it can be a two-edged sword. If you disclose that diagnosis, your employer may go about documenting your deficiencies in the workplace in order to get you removed, or at least begin to file whatever steps are necessary to seek your dismissal. So I've seen that happen, as have my colleagues, and we don't wish to subject you to that unnecessarily. So no, you shouldn't be disclosing your diagnosis to every employer, regardless of the situation. I recommend that you meet with the Human Resources Department if there is one, or speak to other longer-term employees who've been there longer than you have, to find out just how sensitive this workplace is to people with disabilities. Have they made accommodations for other people with any sort of disability, not just ADHD? If they have not, then think twice. This may be an employer that is not very open to such accommodations. On the other hand, if they have, then that's one more reason why you might want to disclose your diagnosis and ask for accommodations. But in general, I suggest, and unless you need accommodations, you keep your diagnosis to yourself and not share it with your employer, supervisor, or others in the workplace unnecessarily. It could come back to haunt you. Now, let's suppose you are seeking those accommodations. Well, these are the questions you have to answer. Are you having problems performing your required work satisfactorily? Can you show, or can the clinician who evaluates you show, that those problems stem directly from your symptoms of ADHD? Don't forget to include here your symptoms and deficits in daily executive functioning, such as time management, problem solving, organization, emotional control, inhibition, and so on. So those are the executive deficits in daily life that are frequently associated with ADHD. So can you show that your problems with work stem from those kinds of symptoms? Let's suppose you can. Okay. Can you or the clinician then make a list of specific accommodations you would like to have to address those specific symptoms and workplace problems? So the accommodations have to be targeted reasonably and directly at the workplace problems and your symptoms. You can't just ask for a corner parking spot near the front door because you have ADHD. How is that going to somehow improve your difficulties that you're having in the workplace? So don't ask for too much, and certainly don't ask for the moon and for accommodations that have no logical relationship to the problems that you're experiencing. Make them targeted at those problems. Are the accommodations you're asking for reasonable? Is it possible that this employer can provide these or not? There may be accommodations you'd like to have, but they're just not going to be considered reasonable within this kind of workplace and the jobs that you're being asked to do and the resources that the employer does or does not have. So again, don't ask for the moon. Keep it specific, keep it limited, make it reasonable, and you're more likely to have them granted. Here's another thing to consider. If you have a disability, you must be receiving treatment for your disability. If you're not getting any treatment whatsoever, it's not your employer's responsibility to make up for the treatment that you're not receiving. So, for instance, if you have problems with vision, but you have decided you're not going to wear glasses or contact lenses, your employer doesn't have to make any accommodations for your visual difficulties if you are refusing to get the reasonable treatments that would be expected for someone with your disability in the outside health or mental health services community. So, are you getting treatment? Are you taking medication? Are you getting coaching or cognitive behavioral therapy? Can you show that you are trying to deal with your disability outside of the workplace? And therefore, the problems you're having at work are in addition to these treatments, and that's why you need accommodations. So show that you're making a reasonable effort to have your disorder treated. Now, does your employer have more than 15 employees? If they don't, they are not required to provide you with accommodations, at least under the Americans with Disabilities Act. That doesn't mean that you can't ask for some accommodations, but they aren't obligated to provide them. So don't go in with a sense of entitlement about what you need to help you with your ADHD at work if your employer doesn't have that many employees. So please keep that in mind. Now, next, some other considerations, right? Was your diagnosis rendered by a licensed clinician? Or was it just some off-the-cuff remark of a, say, primary care provider who didn't really do a thorough evaluation? Also, does the clinician specialize in the diagnosis of mental or neurodevelopmental disorders? If they happen to be a neurosurgeon or a family practitioner, that's probably not going to be good enough because those people generally don't have the training necessary to engage in the differential diagnosis of mental disorders. So make sure you're seeing a licensed psychologist, psychiatrist, clinical social worker, clinical counselor with extra training in how to do evaluations for ADHD. You can see a neurologist, provided they're a developmental or behavioral neurologist. You could see a pediatrician. I don't recommend that, but you could, if someone's been following you for a long time, provided that they too have some specialized training through their medical education and postgraduate education, that is, in mental disorders. So the ADA requires that this evaluation be done by someone who is credible, licensed, specialized, and can provide the appropriate documentation. So do they have the training? Now, remember, it's your responsibility to disclose the diagnosis if you want accommodations. Don't wait until you're fired or you're about to be dismissed and then go around complaining that you have ADHD and you can't get rid of me. Well, yes, they can, because it's not your employer's responsibility to come to you and say, I think you have ADHD. I think you may need some treatment and some accommodations here. That's your job, all right? So if you haven't done that, make sure you do that. That's true for college as well, by the way. Don't expect accommodations in college, much less the workplace, if you haven't disclosed your diagnosis. And then with that disclosure, you provide the appropriate documentation that is necessary to get those accommodations. So, did the clinician create a report for you that you can then share with your employer or the human resources department? Make sure they do. Make sure that the evaluation they did included these procedures. First, they reviewed with you the DSM-5 symptoms for ADHD, and you had at least 4 or 5, although 5 is the requirement in the DSM. 4 is actually what you need to be abnormal off of either of those symptom lists. But 5 would be best if you're seeking these kinds of ADA-based accommodations. So, did the clinician go over all 18 symptoms with you? Did they go over them again, asking about how you were as a child or adolescent? We have to show that the symptoms are not only currently present, but they date back to childhood, adolescence, or even early adulthood. And while the DSM requires age 12, as you know, in my video on this channel on the assessment of adult ADHD and the diagnosis of ADHD under the DSM-5, I don't recommend that clinicians use that age of onset. It has little, if any, validity. So be sure that the clinician included questions and rating scales that focus on executive functioning in daily life, not just the specific symptoms of ADHD. Did the clinician corroborate your reports of your current and childhood history through other people who know you well? And if that wasn't possible, did they obtain archival records, what I call the paper trail, showing that you have been impaired, either in school or in prior jobs, or maybe in your driving record, or maybe you have had substance abuse problems related to your ADHD? Can we show that you suffer impairment from those symptoms? Now, did the symptoms that produce impairment develop by or before young adulthood? Again, ignore the age 12 in the DSM and just establish that there was an earlier onset. Has your disorder had a chronic course? There have been few, if any, periods of remission of your symptoms. Now, impairment, the adverse consequences of your symptoms, can come and go based upon the situation that you're in. Impairment is always situation specific, but the symptoms should have a chronic course. Make sure that the clinician documents that in their opinion. Make sure that the clinician uses appropriate, well-validated, normed rating scales of ADHD for adults, as well as a rating scale of executive functioning, and puts those results in the report. Make sure that they've gone through and documented the kinds of impairment that you've had in your social functioning, in your work life, in driving, and other areas of major life activities, and that they can show that your symptoms and your impairments are greater than what would be expected for the average person. Again, don't compare yourself to high-functioning individuals. It's the average person that matters. Are you doing worse than the average person? That's what the clinician has to establish. If the impairments didn't come until adulthood, the clinician needs to explain why. Maybe it's because you have a high IQ and you're gifted and talented. Maybe it's because your parents got informal accommodations for you, and therefore you didn't need to get a diagnosis and get formal treatment, and therefore you weren't impaired. Also, make sure the clinician documents any comorbidities that you may have. Up to 80% of adults with ADHD have a second or third disorder, and the clinician is going to need to weigh that to determine, are those other disorders the source of your inattention, of your executive functioning deficits, of your problems in the workplace, or is it ADHD? Because ADHD, as I said, is a covered disorder under the Americans with Disabilities Act. So it's your job of your clinician to rule out these disorders as possible explanations for why you're having difficulties in the workplace. And in doing so, they need to show that it isn't simply due to low IQ or to a learning disability, and that it's not due to anxiety or depression. In their opinion, your difficulties, your symptoms, your impairments, and your problems at work are the result of your ADHD. So if you can establish that, then the documentation should be solid enough to get you the accommodations that you're requesting through your employer. So I hope you found this video useful. Remember that the Americans with Disabilities Act is a act that protects you against discrimination. It does not necessarily require that an employer get you treatment for your disorder. That all they have to do is to make reasonable accommodations so that you have access to performing your work in a productive and reasonable manner, and so that you're not being discriminated against because of your disability. So again, I hope you found this informative. I hope you'll join me later for other videos and my research reviews each week. If you're not a subscriber, please hit the subscribe button. And I thank you for viewing this. And again, here in the U.S., happy Thanksgiving, everyone, and be well.